The recovery and the hospital stay, this is very important for the patients to understand before they undergoing surgery, because in this modern world, we are in a wheel and we have to keep the wheel going, keep running in it. Generally, this operation is done as one night stay in the hospital. These operations can be done as a day case as well if one has the appropriate arrangements and the setup in the hospital and at home. One can do this as a day case whereby one can have surgery in the hospital, recover in the hospital for 4 or 5 hours after surgery, and if they were absolutely fine and this was considered that they were safe to go home, they can go home the same day. However, majority of the patients will stay one night in the hospital and go home the day after the surgery. The next question comes, what can a patient expect and what can they eat? Generally, there is no restriction after the surgery. We do recommend to our patients not to eat any fatty food when they have the gallstones so as not to have pain or any other issues with that. But after the surgery, they can eat normally. There's no restriction once the surgery is done. They're allowed to mobilize on the day of the surgery. It's better to walk around and mobilize early because that improves healing and that improves recovery. They are discharged home on the day of the surgery or day after surgery, and they're advised to carry on their activity and gradually build it up. I generally recommend them to take painkillers regardless of the fact whether they have the pain or not for 3 days or so that they stay absolutely pain-free. The whole idea is about the experience because we don't want to suffer. Best to take painkillers, stay pain-free, and then after 3 days or so, take the painkillers if these are required. Sometimes, because of the altered diet and bowel pattern, one may become a bit constipated the day 4 or 5. One can take some laxatives and they can be bought over the counter. We normally do not provide all our patients with laxatives because this incurs an extra charge to them as well as their insurance company. But these can easily be achieved. Majority of the patients will be fine. Some will have constipation, they should buy this. But if there is somebody who suffers from constipation, they can mention this to the doctor so that this can be provided to them with the discharge medication. Because one thing that you do not want to do is your patient going home and then their relatives or themselves trying to go to the pharmacies to get some medicine. You want them to be comfortable in their post-operative phase. The first thing which comes to the patient is return to driving. They can start driving once they're comfortable, which is generally day 3, 4, 5, mostly day 5, I would say. Some people are comfortable by day 3, but one has to make sure that one is comfortable because otherwise our insurance company doesn't cover in case of any accident. So you have to be pain-free to be able to drive so that your reaction times are steady and stable. Return to exercise, we recommend to the patients to walk, increase the walk, and by day 4 or 5, if they're comfortable, they wanted to go to a treadmill or something else, they can do that. Swimming, I generally recommend to them that to avoid swimming for about a couple of weeks after surgery. Wound heals very well within a week or so, but probably it's best to give it another week so that we are not exposed to the chlorine in the swimming pool waters. Sea swimming, if somebody wants to swim with sharks, by all means, there's no problem with that after a week or so. Exercise, light exercise building up to full exercise. Though we do mention to the patients that the things will get back to normal, but still it's a big operation like we used to do it in old days. And it takes about 3 weeks or so after any operation, laparoscopic operation, it takes about 3 weeks or so to become more or less pain-free. And after the 4th week, we will almost feel like we are getting back to normal. So every time we are doing exercise or activity and we are pushing the boundaries, we may feel an odd twinge of pain or discomfort. That should not bother us. We should just slow down and reduce the activity and be sensible at that point, and that should help. And this is the way to look after ourselves, and generally it will work very well. We normally follow up our patients a week after surgery, remove the dressings which stay on for the whole week, and at that stage we just expose the wounds if they have healed very well. That's what we expect, and they do not need any cover for that, and they can carry on as normal.